Alright, what's up? So this is actually the first one of these I'm actually going to do. I had the idea, I don't really see people doing this kind of stuff, but this is how I work with my clients a lot of the time. Someone talking to you about, muscle and body and biomechanics stuff is great, but it's very hard to understand and sort of internalize it if someone's just talking you through it, if you can't really visualize it. So why not visualize it? So this is some diagrams that I drew. What am I doing? Doing myotherapy. Should be an artist, obviously. So I'm in the wrong career, but may as well use my supreme art skills to help people with sort of understand things better. And the better that you understand what's going on with your body, the more that you can do to take control and improve things. So let's talk about the most common thing that I'll see coming in the door, which is people having problems with their neck, pain in their upper back and their trap and the side of the neck, problems turning their head, bending their head, or all sorts of stuff. So we all like to be able to do head checks when we're in the car, or we like to just be able to sit around and have our head not hurting all the time with pain behind the eyes and all sorts of stuff. So, so many people understand that posture is that, oh, my posture is bad. Someone's told me my posture is bad. There's all this problem with, everyone knows that posture is an issue and contributes to stuff going on in your neck and your shoulders. So why don't we just sort of explain a little bit more about that so that people can understand. So generally, let's talk about your neutral spine position, okay? So in a neutral spine, let's say that this is your sacrum, so where your tailbone is, right? And your spine comes up from your tailbone. So let's just do a natural sort of neutral spine curve, okay? So if this is the front and this is the back, so we've got your person's head going this way. See? Yay, happy. And they've got hair maybe, if they're lucky. Okay, so what's this going on here? What's this going on here? Are you saying this is normal? Yes, it is normal. You should have a gentle sort of curve, lordotic curve there if you want the words, and a kyphotic curve there. Another little lordotic curve there, right? So spines should not be straight up and down thing. That's a problem. But we won't worry about that. Yeah, so there should be a bit of a curve. So there should be actually a bit of a forward curve there, which is, if you want a demonstration. Alright, so if you look at my lower back here, there should be a bit of a curve going back that way. It shouldn't be flat like that. That's just weird. So that's, yeah, so you should have a little bit of an inward curve there, okay? Let's get back here. Now, if we look at center of gravity, and if we look at your head, okay, so if we draw a little line going down here, right? So, if you've got a natural spine position is reasonably well over the center of your sacrum, okay? What happens when we sit down in the office or on the couch or whatever it is that you're doing, and what's going to happen is this. You're going to have a posterior tilt in your pelvis. If you don't understand that, doesn't matter. But that's the shape of it. So it goes to be more like that. All right. Okay. So we've lost this curve here. All right. And this curve here still remains, and we've got this. Okay, so where our head was basically stacked over the center sort of line of our spine before, now it's sitting well forward of the spine. And to be honest, if you're looking at someone in an office chair, this is probably actually very conservative position. So let's say we've got the chair here, all right, and so knee, leg, thigh bone and hip joint there, okay? Generally people are going to end up like this. Alright, so they're going to be way forward of this spinal position here. So, okay, that's great. So they're in a funny position. That's bad. Well, why? Why is it bad? Why can't we just be like this all the time? The thing is, if you're like this for an hour or two, here and there, like, every day or every couple of days, probably not going to be much of a big deal. The reason that we actually go into these slumped sort of postures is we're saving energy. Okay, the things that bring us back. So if this person is like sitting down, like in a chair here, if they're sitting, all right, and they're sitting, straight up, they've got this nice natural spine position. The thing is, what's holding them up in that position is they've got muscles attaching the base of your spine, the base of the pelvis here, and they anchor up here. So this is your your paraspinal muscles, right? So these muscles have to do a whole lot of work to keep us in this position while we're sitting. So in terms of, if you think of things from an evolutionary point of view, we didn't always have, a fridge or a cupboard or like McDonald's or whatever you're eating that's, instantly available. We used to have to go out and actually find food, or like if we did have food stored, it would be scarce. It wouldn't be a great energy source. It wouldn't be instant energy available all of the time for everyone. So if you think of it from that point of view, it makes sense to slump and save energy, because it costs us no energy for us to slump and just hang off our ligaments, because they don't have to contract. Muscles have to contract and expend energy to stay contracted. So if these muscles slacken off, that's when we end up like this. So it's actually normal and perfectly okay for you to want to slump. The thing that's not perfectly normal and okay is we've gone from, hunter-gatherers. I don't want to get too prehistoric, crazy, human evolutionary stuff, but the thing that's, we've specialized, right? So we're not up on our feet all of the time, most of us. We're not in funny positions like, I don't know, climbing trees or walking around the forest, or I don't know what we used to do back then. But we're not finding ourselves in all these different positions all the time. We find ourselves in specialized roles where we're sitting for a lot of the period of the time, or we might have, depending on what job you've got, people have got all sorts of different postural positions that they're in a lot of the time, compared to having a big variety of things that we used to have. So that's why the modern day problem that so many massage, physio, chiros, people are getting treated for this problems that come from this posture, just because they're in that posture for so much of the time. Now let's get up to the area that we're talking about. So neck and shoulders up here. So if you've got the idea of all of this, and you've got the idea of all of this, so where the pain is coming from, and to all you pain science educated people, I understand all that, I get all that. For all the normal people, don't worry, it's all cool. So let's look at, I'm just going to get rid of this, hopefully that's you understand that sort of concept. So the pain is coming from muscles that are overstretched, overworked, and you're just exceeding their capacity, and so they're sending messages up to the brain saying, hey, I've been doing all this work, can we do something about it? They want you to, the thing where pain is the thing that is supposed to change your behavior, basically. The pain is there to protect you. Pain should come in before there's an actual problem, to change your behavior, to get you out of whatever you're doing and get you doing something about it. All right, so when we've got this position here, so pelvis, yeah. So what is actually holding your head up in this position? All right, so we looked at those muscles attaching from the pelvis up the upper back before, right? So they've gone slack. But what's holding your head up? All right, if everything goes slack, your head is just gonna, drop down here, right? So the thing that's holding your head up is muscles that are in the upper back, and they're attaching to the base of your skull, and they're pulling that way, right? Because if they're not, then this is where you end up. Okay, so if we want to make it a bit more, so let's say shoulder blade here, and that's an excellent picture of a shoulder blade, I must say. So you've got your upper traps. They're attaching along the top of your shoulder blade, and they're going up to the base of your skull here. What a great drawing. And you've got another little muscle, levator scap. Those are the main two that will need to be looked at usually. So those ones they're pulling this way, and they're keeping your head from slumping forward. Right. if we look at it from the back, so if we go like, alright, so there's your shoulder, and here's your spine, and we're looking at from the back, yeah. So shoulder blade. Yeah, it's a weird thing. Anyway, we've got muscles attaching along here, and they're going up the base of your skull, and then you've got this other one that's coming up here, and they're attaching on the side of your neck. And so these are the main ones that are pulling here. So you've got your upper trap attaching along here, and you've got your levator scap going up here to the side of the neck, and they're probably the ones that bear the most of the brunt of this. Okay, so generally, if we can do some work to address the problems in these muscles, then generally the pain will definitely decrease. But then you've also got to address the postural factors of, someone will go and they'll get a massage, or they'll get whatever treatment it is, and then it's like a few days later or the next week later, it's like, oh man, that didn't fix me. I'm just as bad as I was. Well, yeah, okay, this stuff gets settled down, but if you go back to this, it's just going to do it again. So you need to, understand what's going on here, so that you can do work on this, get it settled down, and then make that treatment last longer. You've got to take some responsibility. You can't just give all of your responsibility to the person treating you and blame them when it doesn't work. So, then again, the person treating you, if they understand this and they can get this across to you, then you're going to be like, oh, okay, well that's why it goes back. So that's why I've got to do some stuff myself. I've got to do some stuff to strengthen up my back so I can hold myself up longer. I've got to do some stuff to take pressure off this. I've got to sort my posture out. Got to make some, implement some plans to deal with that, so that you can improve for a longer period of time and feel better on a day-to-day basis, have your self-maintenance sort of sorted out, and not have to worry about all this crap, because it's such a basic problem, although it can make people a lot of money. Hope that made sense, and yeah, if you like it, good, share it, and we'll do some more. And put in a request if there's like a thing that you've got, and I'll see if I can explain it for you. See ya.